Hi, my name is John Aman. Today I'm going to talk about the origin of cystic fibrosis lung design. Definition: cystic fibrosis is the most common genetic and incurable design in whites. It is a complex pathology that affects many organs of the body, although its age pattern it can manifest itself in different ways and to different degrees. Pulmonary involvement is the most serious and determines the prognosis. Some continued infection deteriorates the lung tissue, and sometimes it becomes necessary to perform a transplant.
Hi, and welcome to another episode of Demystifying Medicine. On today's episode, we will cover cystic fibrosis. We will be discussing the basic biological principles of cystic fibrosis, the organs affected, and the various treatment options for this disease. So what do you, a panda, or a neighbor's pet have in common? You're all made up of cells. The cells can be thought of as the subunit of life. Inside these cells are a set of instructions called DNA. DNA is made up of the bases adenine, guanine, cytosine, and thymine. You can think of these bases as instructions that code for genes in your body. For example, the DNA contains instructions for traits such as hair type, eye color, and height. When a nucleotide base is added, removed, or substituted, it is known as mutation. These mutations can change the DNA code, which may affect the traits that are expressed in your body. Now that we know the fundamental genetic makeup of our body, let's move to the next big question. What is cystic fibrosis? Cystic fibrosis is a disorder caused by mutation in the cystic fibrosis transmembrane conductance regulatory gene, known as CFTR for short. This mutation occurs on chromosome 7. This disease is an autosomal recessive disorder, which means that the disease is inherited when a child inherits a defective copy of the gene from both parents who are carriers of the gene. A carrier is an individual who has a defective copy and a normal copy of a gene, and is unaffected themselves. The CFTR gene codes for the CFTR protein, which is an important chloride channel. The purpose of this channel is to pump ions in and out of the cell. The symptoms and associated complications of cystic fibrosis are caused by the dysfunctional CFTR protein channel, which is found throughout the gastrointestinal tract. Affected individuals have elevated sweat electrolyte levels, pancreatic insufficiencies, and lung infections. These signs are observed in most patients, but not all, since severity of the disease can range widely amongst individuals. In Canada, 1 in 3,600 are born with this disease. Studies have shown that cystic fibrosis is more frequent in European Caucasian populations than in any other population around the world. In addition, in the mid-1900s, the median survival age of individuals with this disease was 8 years, but today the median survival age has drastically improved to 30 years, mainly due to better understanding of the disease and improved clinical approaches. Now that we know more about the disease itself, let's talk about what organs are affected and the various treatment options available. Recent studies have shown a higher understanding of the underlying causes of cystic fibrosis at a genetic level. More than 1,500 genetic mutations have been linked to the onset of this disease. However, the most relevant mutation, found in 66% of affected patients, is the deletion of the phenylalanine in position 508 on the CFTR gene. This inherited disease mainly affects the lungs, pancreas, liver, intestine, and sinuses. The most prominent organ affected are the lungs. Excess mucus causes infections and eventual permanent lung.
Application in medicine. In medicine, it is necessary to identify in a right way a person who suffers pulmonary cystic fibrosis for the correct treatment. This design manifests in its classic and habitual form as a chronic obstruction pulmonary design, pancreatic insufficiency, increased chlorine in sweat, and infertility in men caused because obstruction azoospermia. Less common presentation in patients include normal number of electrolytes in sweat with mild pulmonary design. In babies, for 5 to 6 years, there is a test that is made in babies in their birth. They use their health blood to know if they are sick or carry the design.
Cystic fibrosis, or CF, is a genetic disease that affects multiple organs, including your lungs, and limits your ability to breathe over time. Your main airway, called the trachea, branches into each of your lungs. The largest airway within each lung is called a bronchus, and each bronchus branches into smaller airways called bronchioles. Normally, airways are coated inside with a thin layer of fluid and mucus. The mucus catches dust and germs from the air you breathe in. Then, hair-like projections on the airway surface, called cilia, push the mucus, trap dust, and germs out of the lungs. In cystic fibrosis, the mucus is so thick and sticky that the cilia can't push it out of your lungs. This thick, sticky mucus can build up, trap germs like bacteria, and block your airways. Because of this, you may periodically have acute infections or exacerbations of the disease, causing symptoms such as increased coughing, production of mucus, and shortness of breath. As the disease progresses, long-term damage can occur in your lungs. This happens when germs, like bacteria, get into your lungs and cause chronic infections and inflammation. But there's a lot you can do to control the infections and slow the progression of lung damage. Talk to your CF care team about how the different parts of your treatment plan can help keep you healthier. As your partner, they can help you find ways to fit your treatments into your daily care routine.
Pros and cons. Pros. If during childhood the child is well cared for, being very careful with infections so that they do not cause respiratory disorder. When they reach adult, they will arrive with much better lung function and with a better quality of life. About 15 years ago, the life expectancy of this patient was 20 years, and however, today it is possible to speak commonly of 14 and 45 years, even many more. Today, you can aspire to be between 5 and 10 years with complications after a lung transplant. Cons. They are patients much more prone to get pneumonia and bronchitis. There are those that are treated well from the beginning and are more or less controlled, but there are also a very aggressive ones that end up in lung transplantation. Transplantation involves a lot of immunosuppression. You have to lower your defense, a lot of that cause a series of important disorders. Issue applied in Ecuador. In Ecuador, it is estimated that one out of every 11,252 live births presents cystic fibrosis, genetic disease without cure and with lifelong treatment. This is really be the project of early diagnostic of cystic fibrosis developed by the Faculty of Medical Science of the Central University of Ecuador. This research states that at least 10% of cases can be identified at birth if the test is performed with neonatal screening.
The question will arise as to whether or not the baby will have cystic fibrosis. Now, to have cystic fibrosis, you need 2 copies of the abnormal gene, but 1 copy comes from the father and 1 from the mother. Every child born to somebody who has cystic fibrosis will be a carrier, but whether or not the child has cystic fibrosis will depend on whether the partner is a carrier of the gene. So for the man considering having a child, it's important that the partner is tested to see whether she carries the CF gene. If she does not, then the child will be a carrier. If the partner does have a CF gene, the couple may choose not to have a child with cystic fibrosis, in which case there is a technique called pre-implantation genetic diagnosis, by which an embryo can in effect be created and tested to ensure it does not carry 2 copies of the CF gene. If the embryo did have 2 copies, it would be discarded, and an embryo that tests as a carrier only would be implanted into the woman's womb. 1 in 25 of the population carry a CF gene, but there are many, many CF genes, and we only test for about 50 of them, so the test is not absolute.
In conclusion, severity of the signs and age of diagnostic can affect an individual's health and the course of the disease. Likelihood of getting cystic fibrosis is based upon your genes. Thank you.